Dr. Hussain, good to see you again, sir.
Likewise.
Yes, unfortunately, here we go again, especially after NFL safety Damar Hamlin had his heart stopped during a nationally televised game. Now the son of LeBron James reportedly had the same thing happen. We keep saying cardiac arrest. I feel like the first thing we need to do is sort of disambiguate for people what's the difference between that and a heart attack, which we've heard of.
Sure, great question, Tim. So a cardiac arrest basically means there's no blood supply going to the brain, which causes folks to pass out. So they can collapse, they can faint. Heart attack, on the other hand, the heart is still pumping, but is not getting enough blood supply to the heart muscle, which causes then chest pain, shortness of breath. So there are different reasons for both of them. For cardiac arrest, the reasons could be an arrhythmia, which is a rhythm disturbance, most commonly, or it could be a congenital issue, inherited cardiac condition. There's a whole spectrum of conditions that can possibly lead to cardiac arrest. We have seen, however, over the last several years, high-profile athletes pass out suddenly while practicing or while playing a game. If you look at the data, it's still relatively rare, Tim. So 1 in 40,000 to 80,000 athletes will have something like this, but it still remains rare.
Yeah, and I was just mentioning before, if you go back in basketball history, former Boston Celtics star Reggie Lewis collapsed and died, suspected it was an arrhythmia. Even further back, 1989, a college basketball player, famous one, Hank Gathers. The reporting was that he knew he had a heart condition, but was weaning himself off medication. Either way, not talking about whether that's true or not, but it leads me into the question of what can you do about this once you have it?
Yeah, that's absolutely right. So the discussion that folks need to have, especially when you have a child or a son, daughter who's more inclined towards the athletic arena, is to make sure they have a primary care doctor appointment to get that annual checkup done to see if there are anything in history, in your family history, or medication-wise that you're taking that can predispose individuals to, a rhythm disturbance or something that we can control.
Is there anything predictive out of that? I mean,
there's no general screening that is recommended, but again, looking at individual family history, medications, et cetera, may help determine if someone's a higher risk.
Yeah, I hate to say it, it's kind of like earthquakes. It's really tough to sort of predict them when they come. You just have to be able to deal with them as well as you can once they happen. So that's what we certainly hope happens with Bronny James. While we have you, I want to talk about rates of stillbirths in the United States. I guess they had been dropping for a while and then they stopped. Do we know why?
Yeah, this is a public health issue. So for several years they were going down, Tim. Since the onset of the pandemic, they actually ticked up and now they've stalled, which is bad. Now, if you look at the data, it actually shows that minorities, especially black women, tend to have double the rate of stillbirths compared to white women. There are a number of reasons for this. Access to care is one of them. There needs to be more attention, more funding, especially targeted at individuals that are higher risk to prevent stillbirths. But we still, as a developed nation, lag behind other developed nations when it comes to this metric in particular. So more effort, more emphasis is needed for sure.
And we seem to lag behind on a lot of related issues. Maternal mortality, especially amongst black women.
100%.
It's a lot higher than white women.
That's
and
right.
A lot higher than in other countries.
Exactly.
Access to care, the main thing
is one of the problems there, yes.
Yeah, always multifactorial, though. It's tough to try to distill these complex things into short talking points for the short time we have. But thank you. That's what you do so well, Doctor.
Thanks so much.
Good to see you again. Dr.
Likewise.
Syed Hussain from Trinity Health of New England.